health headlines this week. Colorado football coach and NFL Hall of Famer Deion Sanders revealing that he underwent surgery after being diagnosed with bladder cancer. That football legend says his oncologist now considers him cured. This news is sparking a conversation about bladder cancer. And joining us now to tell us more is Dr. Joseph Wagner, chair of urology at Hartford Healthcare. Doctor, it's great to have you with us today.
Thanks for having me, Catherine.
Well, according to the National Institutes of Health, the NIH, an estimated 85,000 Americans will be diagnosed with bladder cancer this year alone. What are the most common symptoms, and are there any known risk factors?
So unfortunately, some patients don't have any symptoms, but the most common symptom is blood in the urine, either blood that you can see as the patient or blood that the doctor can see with a microscope. Other symptoms are urinary symptoms like frequency, urgency, decreased force of stream. The main risk factors are smoking. Smoking is the #1 risk factor by far. There's also toxin exposures to certain chemicals, and radiation exposure also increases your risk of bladder cancer.
Yeah, great information there. How is it diagnosed, and what are the treatments for bladder cancer?
So it's diagnosed with a combination of imaging, usually a CT scan or an MRI, and cystoscopy, where the urologist puts a small telescope into the bladder to see the bladder tumor. Once it's documented that it is a bladder tumor, we bring the patient to the operating room and then scrape out the tumor to see how deeply it's going into the bladder. Thankfully, about 2/3 of the tumors are superficial. Those can just be monitored and no further treatment. Some require medications to be put into the bladder. And unfortunately, about 1/3 of patients require to have their bladder removed, as did Mr. Sanders.
Yeah, so Deion Sanders, he's been very open about this. He wants people to know. He wants people to get checked. Tell us about that procedure that he had with removing the bladder.
So removing the bladder is a big operation. In a man, we remove the bladder and the prostate. In women, if the uterus is still in place, we remove that and a part of the vagina. We then have to make a new bladder. No matter what type of bladder the patient picks, it's made out of intestine. And they can either have what's called an ileal conduit, where they wear a bag. That's the simplest operation, but it does require wearing an appliance, a bag. There's an Indiana pouch, where the patient catheterizes their pouch every few hours to empty their bladder. And then there's a neobladder, and that's what Coach Prime had performed, where the neobladder is hooked up to the urethra and the patient voids through their urethra, sort of like they used to, but also quite differently.
All right, great information. We are so glad that he is on the mend. Dr. Joseph Wagner, chair of urology at Hartford Healthcare. We really appreciate your time today.
Thanks for having me.
Thanks so much.